to this COVID-induced online discussion, a Brookings Doha Center webinar on the implications of COVID-19 for peace and security in the Middle East. This is, of course, a multifaceted topic. It does come in many shapes and forms. Some might, dare I say, even argue that the Middle East has become synonymous with conflict. That said, we will be taking a deep dive into this particular topic to see whether COVID-19 will, whether it might actually have limited impact at all on the various conflicts that are engulfing the region at large. Conflict in the Middle East cannot be understated in terms of its impact on societies, on state capacity. The numbers are truly staggering. Hundreds of thousands have been killed, millions have been displaced. In Syria alone, 500,000 people have been killed. Water supplies, medical facilities are routinely targeted. The conflict in Yemen has produced what the international community has described as the worst cholera outbreak in modern history. That said, I'm very pleased to say that we do have a number of panelists for you today who can, in fact, break down the complexities of the topic we're addressing. They are perfectly positioned to look at the humanitarian implications that COVID-19 might have on the conflict landscape, and in fact, tell us whether COVID-19 could potentially be a rallying call to force through either a cessation of hostilities or perhaps a lasting settlement to the various conflicts engulfing the region. I'm delighted to welcome Frederick Weary from the Carnegie Endowment for International Peace. In Iraq, we have Tanya Gilly, a former member of the Iraqi parliament and director of SEED. A warm welcome to you, Tanya. And we have Ghalib Dalai from Turkey, who I believe right now is based in Germany, of the Robert Bosch Academy, and also a fellow at Oxford University. The format for the discussion is one where I hope to generate a conversation, dynamic style interaction between the participants, and of course between the participants and you, the audience. They've each been given around 5 to 6 minutes for their initial opening remarks, after which we'll have a chance to ask them some questions, provide some follow-up questions, and of course give the speakers themselves a chance to extend and elaborate on their initial opening remarks. Fred, let's come straight to you. You wrote an excellent piece in the New York Times last week, which gave us a sort of overview of where things stand in the region, but it also presented a somewhat gloomy picture of where things might be going in the aftermath and in the midst of COVID-19 and the pandemic. I'm hoping perhaps you could give us a lay of the land approach to this topic, and of course, extend the analysis that was contained in your article. The floor is yours, Fred.
Great. Thank you so much for the kind introduction, and thanks for the invitation to speak here today. So I'm going to sketch out a number of long-term trends that I see arising in the Arab world from this pandemic, or rather from the aftermath of the pandemic. And I think there's always a danger that we're going to read too much through the lens of this virus. I was reading a historical article that termed it microbial determinism, and so we see too much resulting from this pandemic, when of course there are a number of other trends ongoing in the Arab world, climate change, and most importantly, human agency, right? Leadership matters. That said, that's probably a debate for future historians. This is certainly a momentous event whose consequences will echo for decades. So I think the long-term fallout of this pandemic will be shaped by a number of issues: state capacity, institutions, economic resources, and leadership. And I think, in determining how states respond, trust is very important. It's not simply a matter of democracies or authoritarian regimes, but capacity and also trust. And I think, in the short term, here are some, I think, sort of 6 trends really I see moving forward. the first is the amplification of conflicts, right? And so the most ruinous effects of the virus will be in those active conflict zones: Yemen, Libya, Syria. I focus a lot on Libya. Of course, the trends there are replicated in elsewhere. The disease's impact is worsened by a depleted health infrastructure, service capacity, fragmented political authority, and most importantly, the cynical use of the conflict and the disease by warring factions. So the pandemic and the public health response could be weaponized and instrumentalized by factions. It could increase the power of sub-state actors. So medical supplies like tests and protective equipment could be channeled to fighters and favored communities or factions. They could become currency on the black market. All these wars, we've seen attacks on medical facilities to break the will of civilians. Another danger is the stigmatization or directed violence against specific communities, and here migrants and refugees are a particular risk. We can talk about the hopes for a ceasefire. Again, I'm somewhat jaded coming from Libya, where you've actually seen an escalation by the warring factions and also the outside states that are pouring in support. The second trend I think we're going to see in the midterm, near and midterm, is an increase in state control. So states, Arab states are going to get a reprieve, right? People in the region are realizing you need a strong state, you need expertise, you need the distribution of aid, direction, information. And so that temporary sort of dividend really could be exploited by authoritarians. And we're already seeing some of that in this sort of creep toward emergency measures that could in fact become permanent. States could implement new forms of surveillance and tracking, ostensibly to deal with the virus, but in fact to deal with public political dissent. The public protest that we saw in the Arab world over corruption and economic inequity could be halted, but not permanently. I think they're going to be reconfigured. So you're seeing activists take those protests, now shift their energies toward humanitarian concerns, but that doesn't mean these protests aren't going to reemerge. And I think the lull of this virus could actually give the activists time to recoup, regroup, and emerge with new force. Once the first wave of infections subsides, the restrictions are lifted. This is going to be a crucial test for Arab regimes, because then you're going to deal with the economic fallout. And I think that's where you're going to see a window where you're going to see increased protests, unless there is some wise leadership and reform. Which Arab states are at risk? Obviously, the ones with low capacity, high population, low trust, those states that are dependent on outside money, remittances, especially from the Gulf, tourism. I think many of these states are known to many of us: Morocco, Jordan, Egypt, Algeria. Algeria, even though it's hydrocarbon rich, has witnessed sustained protests, and there's low trust in the government. Lebanon, interestingly, there was an article today in the Washington Post that says Lebanon's dealing with the actual infections, the actual virus, in a very astute manner, but that doesn't negate the enormous, economic fallout of this crisis. I think Tunisia bears special watching here. Trust is very high in the government, but the economic strain, you're talking about the devastation of the tourism sector, the coastal industrial regions, that's going to have a knock-on effect. It's going to force the government into some austerity measures. You could see more protests. You're already seeing protests. The fourth trend that I want to highlight is these blocks of wealthy Gulf states. They're gonna be in for a bumpy ride. They're gonna weather this, but most importantly, they're not gonna be willing to bail out other Arab states as they have in the past. And I think that's what distinguishes this crisis from previous crises, whether it's the 2008 economic collapse or the 2011 Arab uprisings. So in combination with the low demand for oil, these states are suffering because their diversification attempts, trade, logistics, tourism, constructions, these have all taken a hit because of the global economic downturn, they're going to face tough choices at home. And I think they're going to direct the bulk of their stimulus to, keeping their own populations happy, buying off dissent. I'm very worried about Bahrain here, which witnessed protests and has entrenched sectarianism. We can talk about that in a bit. But the foreign policy implications of this pandemic's impact in the Gulf are significant because they're less likely to give aid to those poorer states. If they have to give aid, it's probably going to be in their near abroad in the GCC rather than to Egypt or Lebanon. An interesting point we can debate is this lack of a bailout. The fact that the fire brigades are not coming, that these states like Jordan, other states can't count on an economic bailout. Could that be an impetus for them to reform as a sort of, encouragement for them to loosen restrictions? There's some arguments for that from the 1980s in Jordan that we can talk about. The fifth trend is that, and this is a long-term trend, as you see the attrition or the strains on government capacity and administration, you could see the rise of informal or sub-state governance. And you're already seeing that in a number of border regions in the Arab world. It could extend to cities. Already in this crisis, sub-state actors, to include militants, are filling the gap in terms of service delivery and public health. And you could see states in the region over the long term willingly devolve some of their services to sub-state actors. We have to think about Iraq during the sanctions period, or Libya. I think similar economic strains could push states in that direction. The sixth effect that I'm very interested in is on the monopolization of force, or the transformation of Arab security sectors to include within Arab states, but also the regional balance of power. And obviously militaries, Arab militaries, are stepping into a public role now. You're seeing the militarization of the public health response. In some cases that has been welcomed, in other cases it hasn't. It could actually extend into the economy if things get worse and people demand perhaps more of a military role in the economy. You're seeing the blurring of lines between the police and the army, and that has important implications in a place like Tunisia, for instance, where the military was trying to get out of a policing role. There's also implications for force composition. Again, you're seeing the upper echelons of certain militaries, senior officers getting infected. What are the implications, the long-term implications of that? And also implications for readiness, training, security assistance, counterterrorism. Obviously, you've seen an uptick in ISIS activity in certain areas because the security forces are now hunkered down. And the last trend I'll talk about is the potential for regional wars and interventions, especially by what I call middle powers, regional middle powers. And there may be down the road an impetus for some of these states like the United Arab Emirates to dial back their intervention in a place like Libya, for instance. But I think there's going to be a lag there. And again, these states are already intervening in ways that are somewhat low cost and deniable, using mercenaries. So it's probably too early to say that the proxy wars in the region are going to stop because of this pandemic's fallout. Another argument is that these states could actually increase their adventurism as a distraction from some of their economic and political woes at home. And with that, I'll just stop and we can look forward to the discussion.
Fred, that was very helpful and instructive. I particularly liked your efforts to balance the short-term immediate implications with the long-term. And I'll most definitely come back to you to see if you could perhaps elaborate on two particular points that you raised, which for me personally, I would say I have a special interest in, and that's the potential for reform, the impetus for reform, I believe is how you phrased it.
Right.
How likely that might be given the track record of some of these states when it comes to the arena of good governance and reform efforts, but also the consequences of sub-state actors filling those governance voids that you noted, and the long-term implications that might have, not just for security, but also, things like the well-being of vulnerable communities, service delivery, and so on. And with that, let's go straight to you, Tanya. Based in Iraq, the Kurdistan region of Iraq, I know you're personally involved at the front lines of the humanitarian effort, especially when it comes to protecting the vulnerable. Iraq has a growing list of crises and challenges, not least the challenges that have emanated from the recent protests. It's many years of efforts trying to force through reform. The protest movement has had a marked impact in that regard. And now the country has to deal with another potentially existential threat in the form of COVID-19. I was hoping perhaps you could give us your thoughts as somebody who is on the ground in Iraq, in Kurdistan, to see how that crisis is being managed, but also how it's being managed alongside the various other existential crises and challenges Iraq has had to contend with in recent years. The floor is yours, Tanya.
Thank you, Ranj, and hello to everybody. It's interesting, actually, what Frederick was, when he was talking about Yemen, there are actually a lot of parallelism between what's going on there and what can be happening and what actually is happening in Iraq. I'm going to give you a very brief summary as to how things have actually unfolded with the whole COVID-19 situation that we had, or the pandemic. So, for example, if we're talking about how the actual first cases of COVID-19 came, they actually came from outside the country, obviously. They came from Iran. So what this COVID-19 pandemic has done, it has definitely destabilized the country to a certain degree, because it was mainly Iraqis that were returning from Iran, or it was Iranians that were coming to Iraq to study, etc. These were the first two cases that were actually documented in Iraq. But then this led to a certain level of instability in the country, meaning that, for example, one of the things that happened was with Iraq getting the test kits in the beginning, they actually did not give the Kurdistan region its share of the test kits, and the Kurdistan region actually had to go outside and to be able to acquire those test kits so they can actually do the testing inside the country. So instead of actually the COVID-19 pandemic bringing the people together, it has actually created a greater divide. So there were many reports in the social media, for example, we were saying that, the epicenter of the COVID-19 is actually from the Kurdistan region. They wanted to cut off the borders. There is no, the lockdown was very much us versus them, meaning the Kurdistan region versus the rest of the country. We saw a disparity with regards to the numbers and how those numbers were being reported in the Kurdistan region and how they're being reported in the rest of Iraq. But, there are so many factors that actually led to this disparity even becoming greater. Was obviously the volatile political situation in the country. So, right now we are still waiting for this new government to be formed. We still are in the process of a caretaker government. Adel Abdel Mahdi, the current caretaker prime minister, recently has actually released another letter requesting that this new government being formed as quickly as possible. In the last few weeks, we actually saw some exchanges happening between the different factions in the country. So there was one person who was designated as prime minister, but then Adnan al-Zurfi, but then his designation was actually pulled out. And now we have a new prime minister designate, Mustafa al-Kadhimi, who also is the hopes of him being able to form the government. People are still waiting in a wait and see kind of situation, just because of the fact that, there's so many other factors, like, the falling of the oil price, can do and what they can provide to their citizens. So there's all this talk about new austerity measures now, which will make the situation much worse, because we were already, even though Iraq supposedly is a rich country, but we already had many issues with regards to paying the civil servants, providing services like electricity, good healthcare, etc. These are things that are almost actually non-existent in the country. So we find that the humanitarian need in the country has actually gone up with the COVID-19 pandemic, rather than the country being able to control it, or the government being able to control this. So but also what has happened with this pandemic, it's actually has created or given ISIS or Daesh an opportunity for them to regroup. So for example, in the period of April 1st to April 15th, we had seen a doubling up of the number of ISIS attacks compared to, let's say, March, for the whole month of March. And some of these attacks were actually taking place in broad daylight. So this is meaning that, ISIS is feeling that they are being empowered and they can go ahead and they can continue with their activities. Obviously, we have the pulling out of the coalition forces from some military camps or military installations, has actually empowered ISIS as well, and seeing that as an opportunity for them to be able to regroup. And that's why we're seeing a lot of these attacks happening in the rural areas, and then which would actually also lead to them being the alternative force or the proxy that can maybe able to provide some services to these people in the rural areas if the government cannot get to them. So that is something that we have to be watching very closely, and we have to be very mindful of. Also, if we're talking about the formation of the government and what that has done, so we did have a very strong demonstrations. We had people on the streets, basically in Tahrir Square, opposing the current government and asking for reforms, etc. But that has been stopped because these activists were actually told, and they were forced to go home, basically. Has it been an opportunity for them to be able to regroup? I'm not sure if that is the situation, because of the fact that, the current political factions are moving ahead with the formation of the government, and may not necessarily respond to what the request of the demonstrators has been. But there's one other thing that has happened during this COVID pandemic, and I think that has led to even more instability in Iraq in particular, and that is the attacks by the Turkish air forces on the region. In the last 15 days, again from April 1st to 15th, there has been about 34 attacks by Turkish air forces on the so-called PKK strongholds, and this has actually led to more instability, whether we're talking about the instability in the forces within the Kurdistan region, but also in Iraq as well, because the country, the current Iraqi government is so busy trying to worry about this pandemic, forming a new government, etc., that this has actually given an opportunity for outside forces to meddle more in the country's affairs, or taking advantage of the situation and attacking more, I guess you can say, again in broad daylight and more openly, trying to attack these areas or these forces within the Kurdistan region. With regards to the U.S.-Iran tensions as well, this is another point that I do want to talk about. The COVID-19 has had an influence on those tensions, or exacerbating those tensions. It has, to a certain extent, because again, as I was talking about, the coalition forces pulling out during this time frame, what it has created is it's given more leeway for Iran to feel that yes, it can move in. So we're seeing a lot of activity by the proxy groups, or the PMF affiliated groups, where they are actually attacking. They're attacking. Not so much installations, but also recently they had called on, or that they're willing, or they're going to be actually increasing their attacks against U.S. interests in Iraq, meaning, it could be any group that is affiliated with them, any, even if logistically, or any group that is working with them. So what this has done, again, is that it has created more of an instability in the country. And as we are seeing, for example, even with the formation of the government, what is happening is, all sides are basically trying to influence this whole process of the government formation and who's going to be holding what ministries, and if the current political groupings actually do or will get a share of the pie. What that has created is that also there is going to be involvement from the outside forces to try and influence this government formation. I think that in general, if we go back, and I really want to talk about the humanitarian situation in the country, what we are seeing right now is definitely, like I said, there's been an increase in the humanitarian need of the population. There's been many areas because of the lockdown. Many people who are day laborers, for example, they cannot go and work, and they have not been able to earn their living. Basically, many shops being closed, many restaurants being closed, etc. That also has contributed, just as it has in many places in the world. But what this has done is, unfortunately, it has created an opportunity for these proxy groups or these non-governmental actors to come in and to do these food drives or distribute these foods or providing medical services, etc. That is actually weakening the government, and that is actually weakening the state. Basically, I shouldn't say the government, but weakening the state and the state institutions, and then also decreasing the trust. Not that there was much trust in the state institutions anyways, but that is also decreasing, which means that we're actually going to be able to we're going to see a rise in these proxy groups or these non-state actors, gaining more and more power, and then this in turn will actually destabilize the country in general. But also, I want to just highlight one other thing too. We are seeing in Iraq, and it is all over the world, and that is the increased number of cases of gender-based violence that we are seeing due to the lockdowns and due to the state actors the state security forces are more involved in implementing the COVID-19 response, that they're actually not responding to the cases of violence against women and children that are happening inside the homes. So we're seeing a lot of that happening as well in Iraq, and we actually have had a couple of cases that have made even international media. I think even the Wall Street Journal wrote about them recently. So the COVID-19 pandemic has been nothing but, unfortunately, as destabilizing destabilized Iraq, and it has worsened the existing conflicts that do exist in the country. It has increased the humanitarian need of the people, and let's not forget as well, we do have a large number of refugees and IDPs in the Kurdistan region, and this divide between the Kurdistan region and the central government, where there isn't where there isn't actually a good exchange, let's say, between the two sides. So, for example, recently now, the Iraqi government or the central government is digging up some old things, and they're saying that we need the money from the oil sales that the Kurdistan region has conducted, so they can pay their own salaries, etc. So in Iraq, things are going from bad to worse, unfortunately, but people, and I think outside forces, are more hopeful now with the formation of the new government that things will be a little more stable. But personally, even though I am an optimist by nature, but I am not very optimistic, because I think that the situation it's just going to be exacerbated with everything that is going on.
Tanya, for that rather sobering overview of the situation in
الرأي العام والوصف للوضع في العراق بالتأكيد سأعود إليك للتوسع في
the fortunes of terrorist groups like ISIS. You raised the geopolitical aspect of this with the interventions from Turkey in recent weeks, but also the implications of neighboring a country like Iran, which faces a catastrophic crisis as a result of COVID-19. But also, perhaps you could also elaborate on the global lockdown has had implications for how civil society organizations function, especially donor agencies and international organizations more generally. Iraq is heavily reliant on these institutions and organizations to fill precisely the sort of governance voids that you and Fred have noted in your initial remarks. So we'll have a chance to come back to all that. Let's move on to you, Ghalib, and zoom in on the Syria conflict.
إذا نريد أن نتحدث ونعطي الكلمة للسيد غالب. إذا بالنسبة لسوريا لدينا الأراضي التي يسيطر عليها النظام، لدينا إدلب والشمال الغربي، ولدينا كذلك المنطقة الشرقية الشمالية التي يسيطر عليها الأكراد. إذا هذه تعتبر مجموعة أراضي تسيطر عليها مجموعات ميليشيات تعمل على الحرب. هناك الكثير تعمل على الأرض هناك الكثير من الدول الموجودة والممثلة على الأرض. لقد بدأنا بالحصول على أسئلة فيما يخص تبعات كوفيد-19 على سوريا. بإمكانك أن تخبرنا عن كيفية احتمالية تطور الأمور فيما يخص هذا النزاع الجاري في الأسابيع والأشهر القادمة، وهل هذا النزاع ربما قد يتأثر أو ربما تتفاقم الأوضاع، وكيف ستجري النزاعات في مناطق مختلفة من البلاد، أخذنا بالاعتبار كذلك دور منظمات المجتمع المدني التي يعتمد عليها السوريون بشكل كبير جدا. إذا الكلمة لكم سيد غالب. شكرا جزيلا راج. إذا في حقيقة الأمر بإمكاني أن أفهم معظم الأشياء التي أشار إليها فدريك، والتي هي تشكل نصف المداخلة التي كنت أريد أن أقدمها. أنا ممتن أنه غطاها عندما يتعلق الأمر بسوريا.
Of this COVID-19 coronavirus, we have to have a time projection because the implication of this coronavirus will be very much dependent on to what extent or how long more that will be with us. If it is going to be with us for another 3-4 months, the implication will be different. If it is with us for another 1 year, the implication will be much more different and severe. So the first part that we have to keep in mind that when we talk about the implication first, what are the time frame that we are thinking of this? Already the region is experiencing 3 crises, at least at the economic level at the same time. One of them is like the economic crisis is becoming like, much more severe. The food crisis, the food security will be one of the major questions as a result of these crises that will be particularly more so for the region. And then let's keep in mind that the Middle East is the most water scarce region in the world. So we are talking about and all these 3 dimensions can be effective by the result of this crisis if this is going on for a long time. At the regional level, if you situate this within the regional level contest between the people and the regime, that is going to have one effect. On the one hand, in a sense, you will see at the societal level, that will be a period of anger accumulation, frustration deepening. On the regime side, it will be basically deepening the security structure, deepening the securitization of the state, deepening the police state measures as much as possible. Both of them are preparing for the post-coronavirus period. So in the post-coronavirus period, you have a society which is full of anger, frustrated, pent-up frustration. In a sense, we can easily move from the anger accumulation to anger explosion part. That is very much a possibility. At the same time, you have the regime very much also preparing for this eventuality as well too. So in a sense, this is for the regime and the society a period in which they both are preparing itself with the new devices for the post-coronavirus context that will very much manifest itself. So from this coming to Syria, officially, according to yesterday, I think the latest number that I have seen was yesterday, officially, it seems that Syria is saying that they have 39 cases and 3 deaths. And if this was the truth, you will see Syria is a success story, given that all the countries in the world, we are talking about the infected cases in tens of thousands, hundreds of thousands, where the Syria is only saying that that it has 39 cases and 3 deaths, that should have been considered as an as a massive success story. But the reality is this number in itself tells us how broken the state is, how completely the state is useless when it comes to, like, meeting and crisis of that kind. And here, like, exactly, this is like what Frederick said, the three things was crucial when it comes to judging the implication of this coronavirus. And this was not only for the Middle Eastern states, it was like the worldwide. That showed us, A, it was the test of the statehood, B, the test of the governance, and C, the test of the public trust. And with this announcement of that you only have 39 cases and 3 deaths, that basically says, like, the Syrian state is failing on all the three. It shows how shallow its nature of the statehood and the state capacity, institutional capacity, how much basically it lacks like any basic provision of the governance, and there's effectively no trust between the state and society whatsoever. I mean, given the fact that particularly in the Middle East, the dissemination or transmission of the coronavirus to some extent has been traced to Iran. I mean, whether this is completely correct or not can be contested, but nevertheless, many states, like that was like the official statement from Kuwait, from Lebanon, that the coronavirus in the Middle East to some extent has been disseminated through the Iran. In a sense, like, as the Trump was framing this virus as a Chinese virus, unfortunately, some in the Middle East was very much quick to frame it as an Iranian virus. In a sense, like, we saw a perfect example of communal stigmatization. And given the very close interlink between Iran and Syria, and Iran and Lebanon, Iran and Hezbollah, Iran and then this militia, this number, the talk of 39 is just like is a joke. But despite the regime saying that the number is quite low, at the same time, the regime also utilized this period for normalization of its image regionally and internationally. We have seen very much effort in this direction vis-a-vis the international institution, but the regional and international actors as well too. This would be also a very welcome decision from the Russian perspective, because for a long time, Russia did want to normalize the regime as part of its political process. Particularly, it was like very much, would have been very happy if the Gulf and the European states, to some extent, normalized its relation with Syrian regime. And here we saw the UAE coming into the picture using
دول أخرى. إذن هناك دول تستخدم هذه المسألة على أنها
solidarity with an brotherly Arab state. This is not a change of policy on the UAE side. Actually, this is the policy that the Gulf wanted to pursue, because for a long time now, the Gulf's priority is the anti-Turkey and anti-Iran policy. And in this regard, the Gulf wanted the Syrian regime to engage in a much more conflictual relation with Turkey, to get the Turkey bogged down in Syria, particularly to shift the focus of Turkey from Libya. Because in Libya, now Turkey, UAE, Egypt, Saudi Arabia is engaged in a quite an ongoing proxy war, and despite the coronavirus, this proxy war is not losing the steam. So therefore, the UAE would be very much interested in a conflictual relation between Turkey and the Syrian regime. And that, as I said, like, that does not actually indicate the change of the policy on the part of the Gulf countries. Actually, the Gulf has been interested in normalization of the relation with Syria for some time, but nevertheless, it was the US pressure in particular prevented them from doing so. Right now, the coronavirus presented a perfect cover for the UAE to engage Syria. So in this regard, the coronavirus is actually not changing the foreign policy orientation of the major regional power in any meaningful way. If anything, there might be a change of tactics, there might be a change of style or speed for sometimes, but at least for the time being, there isn't any shift in the foreign policy orientation of them. Another thing that we really have to keep in mind, another part is with the coronavirus, particularly the economic implication of it, Turkey's need for access to international finance has increased. And particularly Turkey would very much wanted to be included into the swap lines of the Federal Reserve. And to that end, we just yesterday we saw the news that the Turkey will not activate its Russian-made S-400 missile system that was supposed to be activated at the end of this month. And that was, in a sense, a gesture to the US for the financial part. And I think we will see the Turkey being a bit more mindful of the US position in Syria as well, too, because of its land. And the last point is obviously is the refugees, because right now the refugee camp is, each of them can be seen is another Wuhan on the border of many countries. So we have like mini Wuhan in the form of the refugee camp in many parts of the Middle East. And there is a need for an international response. These states, Syria has no capacity, Libya has no capacity, Yemen has no capacity. So here we really need a global compact on refugees, because otherwise each refugee camp is taking the form of a Wuhan on the border state. And as we saw, like with this coronavirus crisis, when it comes to contagious, when it comes to virus, when it comes to those kind of disease, the border doesn't matter much. So here we really need anything. And then the very last point, I agree with.
I have to cut in, Ghalib. I'm very sorry. It's
sure.
We have a range of questions from members of the audience that we have to get to. I'll even put my own questions on pause while we address those questions. It seems like we have a whole bunch of questions, which really goes to the heart of what Ghalib has just mentioned when it comes to this diminished capacity, also a theme touched on by Fred and Tanya, this diminished capacity to deal not only with COVID-19, but also existing challenges and problems, whether it's refugees, the vulnerable. One of the questions we have from the audience is whether really this is an opportunity for outside actors, whether it's the West, whether it's China, whether it's the Gulf states, although Fred has already pointed out it's very unlikely they'll step in to rectify those issues, whether this is perhaps an opportunity in that sense. And for you specifically, Fred, somebody has asked whether there's Western appetite to really engage in the sort of resource distribution funding that has typically framed and shaped Western engagement with the Middle East in conflict zones or post-conflict scenarios specifically. So why don't we give the floor to you, Fred, to answer that question, and then move on to Tanya and Ghalib as well. The floor is yours, Fred.
Great, well, thank you. And let me just thank my fellow panelists for some very insightful remarks. I appreciate Tanya bringing up the issue of gender, which is a huge concern also in Libya for Libyan women. The issue of outside help, I mean, in general terms, what I'm sensing is that's what makes this crisis so different, is that, you know, international organizations are stretched thin, they're consumed. We already know about the Trump administration's unwillingness to engage. You saw the curtailment of aid to Yemen, for instance. The US has been absent for quite some time in a place like Libya. So, you know, you have China stepping up a bit in terms of its, you know, pandemic diplomacy and sort of touting the China model. There's a lot of debates about the traction that's going to get in a place like Africa. You know, I think the Middle East is going to be a place of multipolarity. There are going to be different actors seizing on opportunities. But the message, again, that I would give to Arab leaders is that, you know, you're on your own, right? And so I think that's what makes this so different. I think, of course, you're going to have communities and sectors in the United States and elsewhere in Europe that are going to still be dedicated to helping civil society, right? And to helping, you know, grow things like activism. But there's going to be resource constraints. There's going to be access constraints. And also, of course, in the security assistance realm. I mean, we're already seeing that. I'm trying to think through how is security assistance going to change in the wake of this pandemic.
Fred. Tanya, let's go straight to you and see if how do you see things developing for Iraq, which, you know, as I said earlier, is heavily dependent on outside assistance. The floor is yours, Tanya.
Well, I think that before I talk about Iraq specifically, I think that the US's role, unfortunately, in this whole pandemic has diminished. I mean, especially with the Trump administration now, especially Trump's decision to cut out the funding to the WHO. And we know in a lot of these countries that are in need, you know, especially those that do have conflict in them, the WHO has played the greater role with regards to providing the, you know, the test kits, providing advice to the states or non-state actors on how to handle the pandemic and so on. So, and this has actually created an opportunity for, you know, a country like China to step in. So even in Iraq, we actually had, when the pandemic was just starting to spread, you know, there was a delegation that came from China with you know, a plane full of test kits and other things. And they were advising the government on how to deal with the pandemics and how to, you know, to oversee a lockdown, etc. So in Iraq itself, I think that what we're going to be seeing is that there definitely is going to be, the situation is not going to stabilize at all, but also at the same time that talking from a humanitarian perspective, that the country is way over its head and it cannot handle anything that can happen. And again, I do want to talk about the you know, the drop in the oil prices, because our main source of income in Iraq is the oil. And you know, those prices for almost, like now in some places it's in the negative. I think now the Iraqi oil is in the negatives and so on when it comes to production. What that does is it does not allow the government to be able to handle any of the problems that it's going to be facing. Right now they're talking about austerity measures, they're talking about cutting salaries. That's one of the points that are on the agenda. But you know, they have not been able to distribute salaries as required. So what are they cutting? You know, so how can people find have an ability to be able to find or provide for their families? And also we have another issue in Iraq, and that is food security. Guess what? A lot of the food that is coming or that we are consuming in Iraq is coming from across the borders. It's not being produced internally. So again, this is one of the problems or the issues that we have not been able to resolve in country, and it's going to be it's going to have to detrimental that's sorry, my daughter just walked in, my 3-year-old daughter. You know, it's going to have some detrimental effects on the population. So in general, what's going to happen is that, you know, I think the instability in Iraq, it will continue, and it will continue for a very long time. I think whether we had COVID-19 or not, Iraq was still an unstable country. Iraq is, unfortunately, for me to say this, is a failed state, and it will, you know, but now with the COVID-19 pandemic, that has just created more instability, and will just continue to make Iraq even a more failed state than it is.
Tanya. Alab, let's come to you. We've got a few questions again on this theme of alternatives. You know, if the state itself has diminished capacity, if there is a urgent need to outsource its services to sub-state actors and other organizations, does that present? So somebody has asked whether that could present an opportunity for outside powers to step in and exploit this deficit, this increased fragmentation of the landscape. And perhaps another question you could answer, Ghalib, is whether, ironically, this could be an opportunity for China, in fact, to step in and capitalize on the Western engagement with the crisis domestically, and the limited appetite it's had for the kind of interventions Tanya has mentioned. You know, whether this could be an opportunity for China to step in and shift or tilt the political environment, geopolitical environment in its favor. The floor is yours, Ghalib.
Have to unmute. Okay. Let me start with the last question. Irrespective of this latest coronavirus crisis, pandemic, the region was already was becoming multipolar in its engagement with the international power. So the Russia's entry in the region, the Chinese presence in the region, to some extent the Indian presence that has already been in making for some time. So in this regard, this is not like anything new. This process can a bit magnify this process, but I'm very skeptical that China will have a much bigger role than it's normally had. I think if anything, the Chinese PR activity to some extent, to a great extent, is actually backfired, because like China first has to answer many questions because it's to some extent the crisis got that devastating, that deadly, was the result of the fact that the China tried to cover up this for a long time. So in any case, I think the international public opinion, when we have like more and more debates on this crisis, I think the Chinese image is unlikely to emerge in a better light. If anything, I think the Chinese, despite all the PR activities, all this kind of like the test kits, etc., some of them prove to be not to be very functional as well too. I think the Chinese image international will emerge battered from this crisis. If there is a room for outside power, I mean, let's not forget the nature of this crisis. This is a global crisis. So it's not like only one region having this crisis. So therefore, like the international power stepping in. So this is a global crisis, from the US to China, from Europe to Russia, from Turkey to etc. Everyone is grappling it. I mean, just look at the Europe. The communal solidarity, the European solidarity, was very much dented during this coronavirus crisis, and that doesn't tell us great news about the, let's say, European playing a much larger role in dealing with the crisis in the Middle East. So I'm doubtful that the international powers will have any meaningful role at this stage. So the regional state, the regional communities, the regional nations are on their own. But however, I do think that the role of the sub-state actors are increasing, particularly in the states that are not functioning. And so the role of the sub-state actors are increasing in the states that are not working, like Iraq, like Lebanon. For some times, for some period, we have discussed that in the balance of power between the state and non-state actors, that the power was a bit tilting towards the state actors in the post-ISIS period. But I think with the coronavirus crisis and the state's inability in many places to provide the basic needs is reversing this trend. I think to some extent, once again, we'll see the sub-state actors proving to be much more effective. Highly likely, like actors like Hezbollah will have more prominence in places like Lebanon. Highly likely the SDF areas will also gain more recognition, etc. Highly likely perhaps more engagement with the international actors. So here we will see once again, in the post-ISIS era, there was a talk of the return of the Middle Eastern states. This was a very immature talk in any case, because there was not such states. But I think this crisis once again proved that many of the Middle Eastern states does not have minimum capacity to deal any crisis of such. So therefore, I do think that the role of the sub-state will increase.
Ghalib, it seems like all three panelists, in fact, believe this to be a glorious opportunity for sub-state actors, militias, and so forth. But I also wonder whether, in fact, their social legitimacy might actually decline in the event they do, in fact, fail to effectively and successfully fill that void that the state has left. So that's something for you and, of course, the audience to think about. One of the questions we've received, or a couple of questions, in fact, relates to the refugee crisis in the region. For you specifically, Tanya, somebody has asked whether it's resulted in increased refugees. And related to that has also been the question of service delivery by those militias and armed groups you referred to in your presentation, in a way that touches on what Fred spoke about vis-a-vis the weaponization of this crisis. Somebody asked specifically whether these groups have discriminated when it comes to who they provide supplies to, who they provide services to. The floor is yours, Tanya.
Actually, in short, yes, it has been used to be able to actually provide the support to their own supporters, for example, or people who align with their ideologies, etc. So in Iraq in particular, and I can say this whether it's in the Kurdistan region or either in the other parts of the country, there has been that, and many people have actually said that. Or they have, reached out and they said, we have applied because, X NGO, for example, or X foundation is providing food stuff or they're providing support, etc. We've reached out to them, but they have said that, you didn't, but they were not able to provide us with what we want. We very largely believe that it's because of the fact that we do not align within their own ideologies or what they stand for, etc. So I think this is one of the things that we are seeing with regards to the providing the humanitarian help. It has been quite selective as to who gets it and who doesn't. Whether there has been an increase in the refugees, actually in Iraq, we have not had an increase in refugees, but there has been somewhat of a movement or a shift, let's say, within the IDP communities where, some people may have gone or may have felt that just before the lockdown had taken place, that it's better for them to be closer to family, other family members, or maybe even with the big cities, because they may be able to require to get some more food stuff or some more help, etc. But because the borders in Iraq particularly were closed quite quickly, so whether people coming in, let's say from Syria, that has not increased the numbers at all. Whether the numbers from Iran, people coming in, we haven't seen really that those numbers. At least I can speak for the Kurdistan region. The borders tend to be a little more porous in the south when it comes to Iran, but quite frankly, all the countries around us, they tend to have a much better healthcare system than we do, including Syria. So I don't think there's going to be an influx of refugees coming into Iraq anytime soon because of the pandemic.
Quickly, Tanya, whether those militias and sub-state actors can in fact sometimes provide a more effective service than their so-called counterparts in government and in institutions.
Yeah, actually, yes, and they are quite, because first of all, I mean, obviously these sub-state actors, they tend to be more mobile, they tend to be lighter on their feet, they have wider reach, and they're willing to go into areas, for example, some of those far-reaching areas like the rural areas, the villages, etc. Where there could be an absence of state. It's much easier for them to be able to get into those areas, and yes, they will take advantage of that, and we saw that as well, in the past when, for example, the PMFs were much more dynamic in terms of reaching some of the rural areas than, let's say, the Iraqi forces or the Iraqi army was. So yes, definitely we will see, we have seen an increase with regards to the sub-state actors being more mobile, and going out to these far-reaching areas and influencing those areas. So it can happen, and it will happen. And we haven't just seen it in Iraq, but also, I mean, I was looking at some reports of what was happening in Afghanistan, and the same thing where, some of these sub-state actors, they are taking over for what the state can do.
Tanya, let's come to you, Fred. Listening to what Tanya has just said in relation to militias being much more agile, more mobile, having sometimes, in some cases, more far-reaching influence than the government does. How does this bode for future security sector reform initiatives? Are we witnessing, dare I say, the end of this particular process, specific process in countries like Iraq, in other conflict zones, whether it's Libya, whether it's Yemen? Is the notion of a standardized, professionalized army that SSR is designed to shape and develop really being diminished as we speak? Are we going to witness a proliferation perhaps of some of these militia groups? Are we going to see expanded influence? Or are these really just short-term opportunities that have arisen because of COVID-19, and in fact will go back to the old normal, if one can put it that way, where governments will land back onto their feet and ultimately suppress the space in which these sort of groups can flourish?
So there's been a trend in the region in several of these weak states toward what's called hybrid security governance. So you've already seen militias, acting like the state, providing security. And in some cases, the state has encouraged that or ceded certain authorities to these, militias. And so that trend is ongoing. I think the COVID pandemic, the economic fallout could accelerate that because these states will have, less resources to pay their recruits, to keep a professional army. So you may have sort of pro-government, auxiliaries or militias acting on behalf of the state. And, as we've heard, in some cases that does provide some security, but the problem with militias and warlords is that, security is provided as a private good, and security is a public good. And so I think that extends also to health provisions. I mean, in some cases, these sub-state actors, they can deliver health results, but do they do it only in terms of conditions to certain communities? It's a private good. That's the real problem. And going to your question of discrimination, of course, I mean, I think it's natural to assume that these sub-state groups are going to prioritize health to their own kin, to their own supporters, their own fighters. Now, if a sub-state actor has aspirations to be national, a vaccination program could be a low-cost way to say, look, we're providing this to everybody regardless of sect. And you do have instances of that occurring in the Middle East. So again, I think we need to conceptualize governance in a different way. This binary division between non-state and the state is increasingly being blurred in a number of places. And I think the trend is only going to accelerate because of the pandemic fallout.
Ghala, the same question to you. We have a question asked. Somebody's asked whether you see a Taliban-style peace agreement of sorts developing in the Middle East, whether that's in relation to one conflict or another, or the region as a whole. Can you see the impetus developing for that sort of thing in the way that COVID-19 has done in Afghanistan and elsewhere?
No. So basically, once again, the time frame will be the crucial here again too. So if COVID-19 go on for a long time, which definitely then mean it's no longer we will be talking about a multiple of the crises, the food crisis being the primary one, the economic crisis, etc. Then we might see the state making dramatic decisions as well too. For instance, in this regard, the de-escalation of tension to some extent between Iran and some of the Gulf states might be a possibility if this is going for a long time. But at the same time, as I think one of the panelists said as well too, that can go the other way around, because when the state is failing on the home ground, they will try to divert the attention from its inability from the home ground being much more adventurous on the foreign policy ground and on the security ground as well too. So here, to what extent the state will actually the state will fail to provide the basic things in the mid to long term, but as the thing stands, I don't expect a similar scenario being applied in the Middle East anytime soon. But again, if this is dragged on for another 6 months to 1 year, then I think any dramatic decision, the jury is out for any dramatic decision to be taken.
In the final 1 minute or 2 minutes that we have, I'd like to ask each panelist in ideally 30 seconds to provide one particular policy or recommendation that they would suggest be implemented for the region at large. It might be country specific, with the aim, of course, of pushing back against mitigating the implications of COVID-19. Let's start with you, Fred, while we give Tanya to come back online. The floor is yours, Fred.
Well, the message is that the region's leaders have to own this crisis, and they have to do it in a way that's astute and far-reaching, and that means, I think, political reform. I mean, technical economic fixes are going to, perhaps staunch the bleeding in the short term, but you really have to open up government to the people in order to get them to buy into these measures and to stem off those protests that we've heard are inevitable, I think, over the long term. So again, calibrated, measured political reform, not, overnight democracy, but if ever there was a moment for reforms, I think it's now. I mean, this is a wake-up call.
Fred. Ghalib?
Well, I mean, for the states that can still be reformable, I would have also suggested to reform themselves. But I think like many of the states in the Middle East cannot be reformed at this stage. I don't think that Syria can be reformed. I don't think that, Libya, what does the reform means in Yemen? So in this regard, I think like, for the international actors, they have to stick in the context of Syria. That effectively means to devise the way that will not legitimize the regime, but at the same time meet some of the basic needs of the population. And one particular place to start with will be an international compact, a global compact on refugees in the Middle East, and that should acquire a global flavor and with the regional participation. But I don't think that many of the regime in the region can be reformed. They just need to be overthrown.
Tanya?
I believe that, that the COVID-19 is a pandemic. It's an international thing. And I believe that it's very important that there is actually a lot more coordination between the different, even state actors in the region to be able to face this pandemic. And also, I agree with both Frederick and
ما قاله فريدريك وغالب في قولهما أنه ربما الإصلاح قد لا يكون.
I think it should help states, or states should really seriously be thinking about mitigating risks. I don't think this is going to be the last pandemic we're going to be seeing the way the world is going. To be how to mitigate risk, how to deal with it. Making sure that they have the proper plans in place, etc. So basically, better planning and better coordination would definitely be my policy recommendation between the states of the region.
Yeah, I think we could genuinely have another hour of this discussion. Unfortunately, we have run out of time, but I do think we have unpacked a very complicated topic, which will unfortunately still be with us for some time to come. We've had plenty of food for thought, so I really do want to thank each of you for your time, for making. For joining us from Iraq. Ghalib, thank you for joining us from Germany or Turkey, not quite sure which. And of course, Fred, for making time so early in the morning in the US. And lastly, thank you to the audience for your questions and for interacting with us. This will most certainly be a topic we will continue to engage with and have additional online discussions, webinars over the coming weeks and months. Thanks very much indeed.
Thank you.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.